Hi, I'm Dr. Maria Sophocles, the Medical Director of Women's Healthcare at Princeton. I've been in practice for about 23 years, and today I'd like to answer some of your most frequently asked questions. By far, the most frequently asked question is always, how come I need a pap smear every year? Or how come we don't have pap smears every year anymore? Pap smears are important and simple tests we use to detect cancer of the cervix. However, the information that you get in a pap smear has changed in the last couple of decades. It now has more information. That means it not only tells us about the cells in the cervix, but it tells us whether those cells have been infected by HPV, the virus that causes most of cervical cancer. So when we do a pap smear, we now have more information with each pap smear. That means we're able to triage women into a higher and lower risk group. Women in a lower risk group simply don't need as many pap smears. Their normal pap smear buys a lot more reassurance than it used to. So currently, we recommend, if you're a woman of reproductive age, that you have pap smears every 3 to 5 years. I know that seems really different than the old days when we all had them every year. But remember, the pap smear itself is different, and each pap smear has more information, so we don't need to do it as frequently. So that leads to another question. Well, then do I need to come for a GYN exam every year? And the answer is yes. Your GYN exam is so much more than a pap smear. It's an opportunity for you to ask questions, to connect with your healthcare provider. It's an opportunity for us to screen you for breast cancer, which is much more common than cervical cancer, and ovarian cancer, to look at the vulva, the vagina, to answer questions about urinary and sexual function, and many other things. So yes, your pap smear is less frequent than it used to be, but yes, you should still come every year for a GYN well-woman visit. The second question that I get asked all the time is, how come pap smears stop at age 65? Can't cervical cancer occur in someone over the age of 65? Well, sure it can, but what studies have shown is that women who have normal pap smears in their 50s and 60s have almost a 0% chance of ever having cervical cancer. So because their risk goes pretty much to zero, we really don't find it to be a cost-effective measure to continue to collect pap smears on those women. If, however, you're someone who's had abnormal pap smears in your 50s and early 60s, we will continue to collect pap smears on you. If you've had cervical cancer or other GYN cancers, we will continue to collect pap smears on you. But for the vast majority of women, pap smears over the age of 65 are simply not warranted. The third question that I get asked very frequently has to do with IUDs. IUDs have become increasingly popular over the last decade, but there are still a lot of fears about them. Maybe this is because there's something inserted into the uterus and left in the body. But maybe it's because in the 1970s, there were a lot of scary incidents that happened with IUDs. IUDs were inserted in women without checking for infection. And when you put an IUD in someone with an STD, they can get very, very sick. And that happened in the 70s, and women died, and it made for enormous negative media coverage, which frankly lasts for a long time. So I still have women come in and say, well, I don't want an IUD because I don't want to die of infection. And I can assure you that we would never, ever put an IUD into any patient if we thought you were going to die of infection. An IUD is incredibly safe, and it's incredibly effective. It's probably more effective than a birth control pill in terms of reliability because there's no human error involved. Once it's inserted, the patient doesn't have to do or remember anything.